Perfect. Well, nice to be here. Thank you, Julia. I'm a pediatric dermatologist here at Texas Children's. So I'm going to switch gears here and talk about the port wine birthmark of Sturge-Weber, what it is, what to expect over time. We're going to talk a little bit about laser treatment. I've got a cute story to share with you at the end, and then I'll save some time for questions. And so a port wine birthmark is made up of capillaries, which are small blood vessels in the skin. And you'll hear sometimes your doctor calling a port wine a capillary malformation, and that's why. They're present at birth, they're flat and they're red, and they'll respond to body temperature. So with hot or cold, you'll notice that your child's birthmark gets darker or red or lighter red, and that's because those blood vessels within the birthmark are expanding or constricting. We know now that with Sturge-Weber, the most important sign in a newborn that a child might be at risk of Sturge-Weber is having a large port wine on the forehead. And that risk goes up even higher if that birthmark also extends to the whole side of the face or both sides of the face. So as you heard from Dr. Shirley, most port wines in Sturge-Weber are caused by a gene mutation in GNAQ. Now, this is not an inherited condition, as you all know, and we have no known reason for the mutation to date. So port wines grow as your child grows proportionally. And sometimes as your child gets older in adolescence or adulthood, they can change so that very slowly they may get darker red in color, thicker, raised, even bumpy in areas. So this is an example of an adult patient of mine, and this is really where the port wine name came from, that over time the port wine can become more purple in color, and then you're seeing some of these little bumps that are sometimes fragile and are prone to bleeding. So this can happen. But I will say, just going back to what Julia said about the family conference, I was also there in Grapevine, and how exciting it was to meet families that I met, several people with Sturge-Weber that had never had laser, and they're adults, and their port wine really still looked very good, no thickening, no raise. So it doesn't always happen, but this is often the progression. And then when the port wine birthmark affects the lower part of the face, there can be overgrowth of the tissues below it. So like the lip, for example, or the gum line, where there can be a distortion of the teeth. Even the bone, like the jawline, can be affected. So what is laser? So laser is a beam of light energy that targets the blood vessel. It's not a surgery per se, in that there's no cutting, there's no bleeding, there's no wound to take care of afterwards. It's all targeted to the birthmark. And the gold standard laser for port wine birthmarks is called the pulse dye. And this is an example of a V-beam laser that I have. So I think the decision whether to laser or not can be very difficult, and it's an individual decision, and there's no right or wrong answer. The pros of lasering are that we all want to make sure our child feels comfortable in their own skin, right? We don't want them bullied when school starts. And we hope with the laser that we can reduce some of those progressive skin changes we just talked about, that thickening and bumpiness. But the cons are, that the birthmark's part of you, it's part of your child, right? I've had children tell me, Dr. Metry, I don't want you to take away my birthmark, it's part of me. And we can, and I can't take it away. We can improve the birthmark in color, but we can't remove it completely. And the improvement that we get from laser is not permanent. It requires many, many treatments. Okay, it can many, and especially in Sturge-Weber syndrome, it can be 30, 40 treatments. And although uncommon, there are risks to laser, to the skin, to the eyes. We have to think about pain control and anesthesia and downtime for your family, right? Because some of you who don't live close to a medical center where there is laser available may have to travel. There's time off work, there's time off school. So I think all of this has to be really, considered before a family makes a decision. If you do decide to go forward with laser, there are some advantages of starting the treatment sooner than later, before adolescence and that thickening and the bumpiness begins. And the reason for that, and I'll even start laser in a young infant, a 4 or 6 week old. And the reason it works better is that the laser only penetrates the skin about a millimeter or less. And an infant's skin is about half the thickness of an adult's, and those blood vessels within the birthmark are smaller, so we can target the laser better. Also, when a child's an infant, I will, if I can do so safely, I will try to do the first, several or more treatments without general anesthesia. And there are some concerns raised by the FDA that repeated general anesthesia in children before age 3 years, before 3 years of age, could negatively affect neurodevelopment. That has not been substantiated in children with port wine stains in general. And you have to think about, well, children who are getting repeated general anesthesia typically have medical conditions, right, that may also explain effects on neurodevelopment. So it's really hard to separate those two, but we do try to do as many as we can without it if we can do so safely. Also, if you laser early, before school age, it may be easier on your child. They won't remember the majority of those initial procedures, the bruising, the purple dots that I'll show you in a minute. It's really hard to go back to school when you're a child, elementary school, middle school with those dots. And then scheduling, as your child, as you guys know, with older kids, they get busier and busier. Then you're talking about, gosh, do we do this on, summer break or on winter time and sports, and all this other stuff gets in the way. So those are the reasons we try to start early when we can. How many treatments are needed? Well, as I mentioned, the average, all the papers will say is around 8 to 10, but it may be less than that or many more. The larger, more extensive the port wine birthmark, especially if it's involving the center of the face, typically those children need more treatment because those areas are a little bit more resistant to laser. How often to laser? Well, it varies. So in infants, if I'm not doing general anesthesia, I'll try to repeat those treatments as often as I can, every 4 to 6 weeks. When they become an age when anesthesia is needed, general anesthesia, around 15 to 18 months, I'll generally laser every 3 months. And then once we get those initial treatments done and we've gotten the birthmark lighter, we maintain that by just doing a treatment once a year or even less. But with hormonal changes, as you just heard, at puberty, I do tend to watch my children a little bit closer because there can be some progression that occurs then. Risk of pulse dye, the purple dots is what I'm talking about. This is the bruising that occurs. And I always tell parents, I show them pictures before that first treatment. Tell them it's going to look terrible, 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 but your child does not feel the way it looks. So it may feel like a sunburn at most. Sometimes children I've lasered don't even realize I did anything until they look in the mirror at home. There can be risks with skin discoloration. So where the skin heals, but it's lighter or darker than the natural skin tone. So that's why sun protection is super important before laser and afterwards. Risk of scarring with the pulse dye laser are pretty darn low. There can be a little blistering. We do recommend moisturizer while those purple dots are healing, but in general, it's a pretty safe treatment. Other risks are damage to the eyes. This is where my cute story comes into play. We are very, very careful about eye protection. So when your child's an infant and awake, we either have people that, very specifically, their only job is to hold gauze or protection over those eyes. In older children who are going to sleep, we have even used corneal shields or special metal protectors to protect the eye so that we can laser around it. And of course, those are inserted after your child's asleep and removed before they wake up. Swelling's really common too. So the eyelid skin's super thin. It swells like crazy. Lips can swell. If your child's older, you can use ice packs, keep their head elevated. The effect on hair loss is controversial. I tend to laser around areas like the eyebrows, especially if the hair is darker, because the risk, I think, of permanent hair loss is very low. And if the eyebrow is thick and dark enough, it will cover the birthmark in that location too. So that's controversial. If your child has skin of color, he or she may still have laser with some modifications. So there is a higher risk of causing skin discoloration. So sun protection is extra important. I often modify the laser a little bit to account for the child of color, and I may space those treatments a little bit further apart in that situation, but it definitely can be done. Other lasers for port wines are the Alexandrite and the ND YAG. And you'll notice the pulse dye. So the wavelength of a pulse dye laser is 595. The higher the wavelength, the number here, the larger and deeper blood vessels that laser targets. So I do use these lasers. However, they have a much higher risk of complications like scarring. I am extremely careful always, but especially with these lasers. And there aren't many studies looking at these in young children, and the results, to be honest, are not that great. And I would never use these in a young child. Pulse dye is the standard of care. But if you have an adolescent and adults, you're starting to see some thickening and you're not seeing a response from pulse dye, these lasers are options. What about comfort anesthesia for your child? Well, for infants, we'll have mom or dad or a nurse swaddle or hold the baby. We'll often use liquid sugar and a pacifier that's called Sweetums, and we use that in the NICU as well for painful procedures. Infant Tylenol and numbing cream can also be used. When children get a little older and they need general anesthesia, that can often be pretty scary. And if you ask it, any children's hospital should have a specialist called Child Life. And they are trained to come in and talk to your child, explain, okay, this is what the mask looks like, this is what it's going to smell like. Let's practice putting it on your face. They may have music therapists like they have at our hospital. Of people can be super helpful for your child. Okay, things to think about when choosing a laser doctor, mainly comfort with that physician. Do you feel like you're working as a team? Can you talk to him or her? Do you decide together, when to transition your child to general anesthesia, when you're going to go to maintenance therapy, those types of things? Staff is also very important. And then how easy is it to schedule? Does the office get back to you? What anesthesia options are available for your child? And financial aspect is very important as well. Do you know what's going to, the deal is with insurance? Are you told up front what your costs are going to be? All those things are important to factor in. And I just wanted to mention the Sturge-Weber Foundation is just the most wonderful organization for Sturge-Weber, in my opinion. But just to mention that as far as the Port Wines is concerned, there is a camp sponsored by the American Academy of Dermatology. It's called Camp Discovery, and it's completely funded by the Academy. There are locations all around the United States, and all you need to do to sponsor a child is have your child's dermatologist or Sturge-Weber physician recommend them to the Academy. And it's just a week with children with all kinds of skin conditions. And I've found that often just meeting another child with a skin difference can make a huge difference for kids. So this is something really to think about. We have one in Texas that's in August, which is like the hottest time in Houston, but a great organization if you're interested. Okay, so here's my little story, and you're going to wonder what the heck this has to do with my talk, but I promise it's going to tie in. So I like to share stories during my talk. So my husband is like a movie buff. I think he's seen every movie ever played ever, but he loves like intense, scary Quentin Tarantino, like those type of movies. And he's learned as we've been married that I'm what he calls a sensitive viewer. So if I watch that kind of stuff before we go to sleep, I swear I have nightmares. I'll wake up screaming. So he's learned like before we go to sleep, we need to watch like animal shows with kittens or puppies or butterflies or something. So anyway, there's this show called Critter Fixers. And these two vets have a practice in Georgia. And it's really fascinating because people bring in all kinds of farm animals and domesticated animals, wild animals. And so I'm watching this episode a couple weeks ago, and this woman brings in this goose. And the goose's name is Mr. Meanie, which personally I think all geese should be named Mr. Meanie because they're all mean. But But Mr. Meany got his name because he chases his other farm animal friends around the yard. And his mom brought him in because he'd been limping for about a week. And because geese only have 2 legs, that was kind of a big deal. So the veterinarian examines him. He does an x-ray to make sure the leg's not broken, which it isn't, but he realizes that Mr. Meany has arthritis. And so, which is not surprising, I guess, because Mr. Meany's 25 years old, and in goose years, apparently that's quite old. So he says, well, I can put him on pain medication and I can laser his leg, which will be an anti-inflammatory, which he did. So, so I'm watching this. I have no idea what kind of laser this is, but he lasers Mr. Meany. But the funniest thing is, is that Mr. Meany's eyes were protected. They had goose-specific goggles for Mr. Meany. I'm like, y'all might not think this is that funny, but I thought this was hysterical. I've got to screenshot this and share it with my Sturge-Weber for my Sturge-Weber family talk. I just thought this was amazing. So Mr. Meany got through his laser procedure. He's all good here. His eyes, his vision is protected. So the moral of the story is, whatever species you are, eye protection during laser is super important. And so I will just end by saying, as far as port wines, there's a lot of hope for the future. So we've talked a lot about that in the conference already, but for port wine birthmarks, one thing that we really need. So with laser, there are different settings on the laser where we can adjust for vessel size and depth. But when you have a port wine birthmark, if I were to sample your or your child's birthmark in different locations, those blood vessels in those locations would be different sizes, different depths. So when we're lasering, we're kind of guessing in a way. So it would be, and this is what Sween already worked on, it would be amazing if we had a way to have some sort of optics or photography that we could see those vessels under the skin and target our lasers more effectively. So I think that's an important step that's going to be coming in the future. And then I think also gene therapy, like you've heard about today, is huge. So eventually, I believe we're going to have even a topical therapy that targets GNAQ that we can use in conjunction with laser. I think those types of things too are on the horizon. So lots of hope out there. And I think that's my last slide. So I will close there and answer any questions y'all have. Thank you.
Thank you, Dr. Metry. I love the goggles. They are fantastic. Absolutely, totally. Like, that was awesome. And I'm sure Dr. Blyden was giggling too. Actually, she wrote so linking talks together. I like it. Annette writes, is there a chance that a child who has laser treatment and then stopped, that the skin will be darker and thicker as they grow?
So yes. So once the family and I reach a decision about, okay, we've gotten the birthmark as light as we want, everyone's satisfied, we stop. But then I continue to follow my patients, once a year or so, or tell them, reach out to me if you start to see darkening. And if or when that time happens, then we do a repeat laser for maintenance. So that way we're always kind of on top of it. We're maintaining it, the lightness. So that's my approach. So yes, if you were just to do that initial series of lasers and stop, there is a very possible chance that birthmark could start progressing again over time. So if you see that with yourself or your child, and it's not the daily fluctuations and redness I was talking about, but really over a few months, you're really seeing that redness get darker. That's the time to talk to your laser specialist about a maintenance treatment.
Linda backs you up. Dr. Metry just says that her daughter is 29 and hasn't darkened since she was 10 years old. So
again, it was you all teach us as much as we teach you, because it was just wonderful meeting people where that was the case.
Absolutely.
They'd never had laser. It had never progressed. Now, granted, some of these were on the forehead location, which we know, as I mentioned, center face is trickier than the forehead, but still, like I said, there are pros and cons to laser, and not everybody needs it.
Jennifer, you have your hand up.
I just wanted to ask, do you put everyone under anesthesia or just children? When you do laser for adults, do you also put them under anesthesia or do you just use numbing cream?
So it depends on the person and the extent of the birthmark. So if it's a very extensive, so entire face, eyelids, I think that's hard to tolerate even for an adult many times. Again, it depends on the person. But yeah, once it really, I don't typically use, I typically use general anesthesia until a child's about age 12 years. I think that's about the age when they may be able to tolerate it without it. But again, it depends on the person and the extent and the location and all of that. When I do decide, when the family and I decide, okay, maybe we should stop general and do topical or instead, I'll usually just bring them in and do a few test spots just to show them what it feels like. So that we can make a decision about whether they can do the whole birthmark. But no, I don't always put people under general anesthesia at all.
Okay. Thank you.
I'm just going to stop the recording for right